Our sponsor for this program is Reno CyberKnife. It's a service of St. Mary's Regional Medical Center. Reno CyberKnife is a painless, non-surgical treatment for many types of cancer throughout the body. Now, I was treated for prostate cancer just about a year ago at Reno CyberKnife, and it was a remarkable experience. We're going to explore that today with our guest, Dr. Tay, who is my doctor on that particular day or that particular treatment plan. Now, before we go there, however, if you or a loved one have received a cancer diagnosis, call or visit Reno CyberKnife at 775-348-9900 or go to renocyberknife.com. That's RenoCyberknife, renocyberknife.com. You can get information that you would want right there. But now we're going to come to Dr. Jonathan Tay, my guest today, who is a person who, let's see, your title, Jonathan, is co-medical director, correct?
That is correct.
Welcome to the show, sir. I must say that I've enjoyed working with you as a patient. Now, this relationship as host and guest is just as enjoyable, I'm sure.
Well, thank you for inviting me. It's a pleasure to be here.
Now, sir, you are, I think, a radiation oncologist. Is that correct?
That is correct.
What led you to get involved in this particular field?
Well, it wasn't too hard because my father is a radiation oncologist.
Wow.
Not that he steered me into the field, but because of my exposure, no pun intended, to radiation oncology, early on and, ever since I was born, I understood what he did. And so always had an interest in medicine growing up. And when I went through school and got into medical school, I wasn't necessarily looking to go into radiation oncology. In fact, I decided sort of late in my medical school to pursue that avenue. It was only when I first started off in medical school, I wasn't sure I could deal with cancer patients. I had
what gave you that doubt?
I thought, well, maybe I should go into something happier like pediatrics, or
I see.
Even I even had an interest in OB at that time. But when I got into my fourth year of medical school, just because my father was a radiation oncologist, just out of academic interest, I took an elective rotation in radiation oncology, and lo and behold, everyone in that field was so nice to me and seemed to be so happy. And I found out that oncology doesn't have to be the gloomy scenario that one might imagine that field to be, but it can be a very rewarding field. And that's what sort of led me to pursue radiation oncology as a career. And, the other aspect of radiation oncology that I really enjoyed was I was very science and technically oriented and had, some basic interest in physics. And radiation oncology is a good way to combine physics and technology and patient care. A lot of medicine that relies heavily on technology loses the patient care aspect of it, but this specialty really is able to combine the two.
Well, certainly my experience in working with you and the CyberKnife program suggests that that's absolutely true, that the two come together. The personal care and the technology are combined in a very unique and special way.
Absolutely.
Yes. So that's a fascinating story, Dr. Tay, how you arrived at this particular field. And it sounds as if, then, you've had plenty of background and experience, including hearing from your father, in this whole field of treating cancer. Let's come down to where you work now. You're working, I understand, part-time now. Is that why you're co-director of the program?
That is correct.
But you're still actively involved.
I'm still actively involved in the CyberKnife program at St. Mary's.
Is that the only cancer treatment modality available through St. Mary's?
No, St. Mary's has an accredited comprehensive cancer program, meaning that we are very multidisciplinary in our approach to cancer. No one doctor can treat cancer alone these days. I cannot treat cancer alone without my medical oncology colleagues who give chemotherapy, and without our surgical oncology colleagues who do surgery and take tumors out. Every cancer situation, every individual is different and requires a different and individualized approach.
So if a patient comes in and consults with you or any other doctor in the program, and the first thing you have to do is look at the individual circumstances, the particular kind of tumor or cancer they're dealing with. Is that correct?
Absolutely. And, accreditation is based on us being able to make decisions in a multidisciplinary way. Many of our patients are presented at what's called a tumor board, where multiple specialists and physicians come together, and support staff come together to provide input into how a patient should be treated. So typically at a tumor board, we have our pathologists who read the biopsies, and the radiologists who review the imaging studies and the scans with us so that we truly understand what's going on. And our surgical colleagues, medical oncology colleagues, and radiation oncologists are there to discuss cases together and make decisions and figure out what's best for a particular individual.
So it sounds like a total team approach in which the person is carefully evaluated. This is not a system where one particular doctor says, well, I'm going to wing it, or I'm going to try to handle this case myself. It's not the case, is it?
That's not the case at all, and that shouldn't be the case with cancer care.
It's good to hear that. So St. Mary's, in terms of treatment modalities, they offer all the various forms that are currently available?
Yes, we have our surgical colleagues who when necessary, do surgery on cancer patients. We have medical oncologists on staff and actively involved in the cancer program who coordinate care with us as radiation colleagues. And within the radiation department, we have multiple ways of delivering radiation therapy.
What are those various ways besides the CyberKnife program?
Well, there's radiation therapy can basically be divided into two types. An internal type of radiation, or something we call brachytherapy, where you actually use radioactive sources to apply directly into tumors or high-risk sites in the body. And then there's external beam radiation therapy, where the radiation source is delivered from an external device and goes through a patient's body to get to the tumor. And the CyberKnife is a form of external beam radiation therapy that is designed to deliver a very high, an ultra-high ablative dose of radiation to a very specific target with sub-millimeter precision.
It reminds me in military terms of a sniper, someone who can focus on a target at a great distance, but finely tune specifically the target.
That's one way of looking at it. Certainly the CyberKnife is a very focal treatment, and it's very good at focal therapy. But sometimes you need other types of radiation to treat more disseminated disease or bigger areas.
So it depends then on the type of tumor, the size of it, the location of it, and so on.
Exactly.
We're going to come back in a few moments and talk some more with Dr. Jonathan Tay, who is the co-medical director of the CyberKnife program at Reno here in St. Mary's. And we'll explore a little bit more specifically the treatment modality of the CyberKnife program and what it's specially for, who can qualify. Dr. Tay will be with us for that part of the discussion. You all come back and join us. If you have a question, feel free to call in 844-790-8255.
Did you know that Noble Pie Parlor has been voted best pizza in Northern Nevada 5 times? They make deliciously different pizzas with the freshest ingredients, like house-made meatballs and sausage, caramelized fennel and onion, and Granny Smith apples. Noble has excellent options for health-conscious pizza fans, too, including vegan and gluten-free, and they always buy the best local produce at places like our Great Basin Food Co-op. The award-winning Noble Pie Parlor has also been voted Best Wings and won the Wingfest Championship 3 times for their famous Pittsburgh-style wings. Noble Pie Parlor has a great weekend brunch, too. Check out the Cal's Omelet and build your own Bloody Mary. Noble even has a full bar with local beers and creative cocktails like the Grey Fox with homemade Earl Grey syrup. Noble also caters and delivers. They're located at 239 West 2nd Street next to the El Cortez Hotel. Call 775-622-9222. That's 622-9222. Or visit noblepieparlor.com.
You did the unimaginable. You beat cancer. And ever since your victory, the sun shines brighter, air smells sweeter, and every moment you spend with loved ones is even more precious. But now, you've just been told that you have cancer. Again. There's a caring team of experts nearby and ready to help you fight cancer again at mycancercameback.com. Whether the cancer returned to the same place in your body or has now moved to a different location, there are non-surgical treatment options available, even if you've already had surgery, radiation, or chemotherapy to fight cancer the first time. Find out more about treating recurrent and metastatic cancer with a caring team of experts close to home at mycancercameback.com and stay undefeated.
Hello, I'm Brian Ralston, Dolan Lexus Concierge. Here's breaking news. Our newly built Lexus dealership is open at 7175 South Virginia Street. We invite you to come and see the newest and finest Lexus dealership in the western United States. With more than 69,000 square feet designed to ensure that you have a one-of-a-kind car shopping experience, you'll enjoy easy parking close to our huge indoor showroom for quick and comfortable viewing of all Lexus models, no matter what the weather conditions are outside. Our new home has a state-of-the-art service department with over 40 service bays and 3 express lube racks. The new Technology Center is set up to help you quickly understand the technology and features built into each of our new Lexus models. Our sales experts don't work on commission and are devoted to you, our customer. Again, I'm Brian Ralston, inviting you to experience Dolan Lexus.
Now can I have the facts?
Welcome back, folks out there in America Matters Land. Bill Tarbell with Just the Facts. Our guest today, Dr. Jonathan Tay, co-director of the Reno CyberKnife Cancer Treatment Program at St. Mary's Regional Center here. Now, before we get to our guest again and talk some more about the program there, I understand we have a new feature as well as a call-in number. We have a text-in number, and that is 775-237-2266. So text us or call in if you have a question or a fact you want to pass along to us. Now, Dr. Tay, we're coming back to the CyberKnife program more specifically in our discussion now. The technology, when I went through the treatment just about a year ago, I was utterly fascinated by the technology involved. I've never seen anything like it before. Can you explain basically how that technology works?
Well, the CyberKnife is a way of delivering radiation, just like other radiation machine, except it is very unique in that it is the only radiation technology that will track a tumor while it's moving in a patient's body, say a lung tumor, and also move the radiation with it to compensate for the positional variation of a particular target in the body, within a certain extent, of course. Obviously, if the patient jumps off the table and runs down the road, the CyberKnife is not going to chase the patient. But assuming that the patient is still and there's only internal organ motion that we're worrying about, the CyberKnife is very good at at tracking that.
We're looking forward to the day when robots can chase us down the street and treat us. But right now,
maybe that's the next generation of technology.
Okay, but so one of the problems I've heard oncologists talk about before is the fact that when a person is on the table or in the location for treatment, that the internal organs themselves can move around. Isn't that correct?
That is correct. For example, the easiest example to explain would be a lung tumor, an early stage lung cancer that is in someone's lung. It can move up and down, right and left, back and forth, front to back, and these tumors can also roll and pitch and yaw. Now, the CyberKnife's imaging system is very unique in that it can track all that, and when a particular radiation beam is going through that tumor, that radiation beam will move with the orientation of the tumor.
So basically, if the tumor... Now, how much of a range of motion is that? 2 or 3 centimeters?
A centimeter.
Just 1 centimeter?
Correct, yeah.
So... whereas before this technology came along, the radiation might miss its target. The CyberKnife can compensate.
Right. The reason the CyberKnife is good at delivering such a high dose is that because it tracks the motion, we don't have to put on a bigger field of radiation to compensate for that movement of tumor. So if you couldn't compensate for the tumor motion, you'd have to put on a bigger target to assure yourself that you were treating the tumor the whole time. But the problem with putting on a bigger target is that you're going to have more normal tissue within that target.
Right.
And that really limits the dose that you're able to deliver. But when you remove those normal tissue constraints, you can deliver a much higher, much more ablative dose of radiation in fewer treatment fractions. For example, for prostate cancer, with a traditional radiation machine, which we also have at St. Mary's, we typically use 44 treatments for prostate cancer.
44.
44. That's 5 days a week, so it would take almost 9 weeks to complete treatment. But with the CyberKnife, because our margins are so much tighter and the dose delivered is so much more conformal to the prostate, the target, that we can deliver much higher doses in much fewer treatments. So for prostate cancer, as you know, we use 5 treatments on the CyberKnife compared to over 1 week compared to 44 treatments over 9 weeks.
Yes, that's what I experienced last year, was 5 treatments within... I think it was a total of 8 days or 9 days, including the weekend. I was completely through the treatment program, and I was able to continue working at a very physically demanding job during that whole time. Is that simply because of the...
That's very typical. Most patients who undergo CyberKnife treatment are able to, if they can drive themselves in for treatment, the treatment is painless, and they can drive themselves home or back to work after treatment.
I can testify to the fact there's no pain. In fact, in terms of sensation, I think I experienced some very, very minor sensation. Beyond that, there was no sense whatsoever that I was being treated.
That's very typical. With any cancer treatment, there's a whole range of how people handle the radiation. You always have extremes on both ends. There's always people who are going to have trouble with any form of treatment. There's always some people who are going to breeze through some treatments. But most people are somewhere in between, and with the CyberKnife, that somewhere in between is very tolerable in terms of being able to continue on with their regular lives.
Well, I can testify myself, at least in my experience, it was painless and truly enjoyable. Since I was being treated just before Christmas last year, I got to select my own Christmas music. They asked me when I went in, the technician asked me what I wanted to listen to in the way of music, and I said Bing Crosby and his fellow singers, and they tuned it right in, and I got to enjoy all that wonderful music while I was lying there going through the treatment.
Yeah, our staff is great. You know, patient safety and comfort is number one priority for them. So there's hardly a day that goes by when I don't see a patient that complements, one aspect of our staff. And that's everyone at St. Mary's, everyone from, the people who greet you when you walk in the door, to the people who put you on the table, to our nurses, and even our physicists who interact with the patients when they have to, and the staff really makes us as doctors look good there.
Well, they always offer good comments about you, Dr. Tay, and I'm sure the rest of the staff would receive similar compliments. But I wanted to mention now, before I actually began the radiation part of my treatment, there was also, I believe, a CAT scan and also another procedure I went through was that to firmly localize the tumor?
Yeah, we have to tell the machine where to put the radiation. So in your particular situation, we did a CAT scan and an MRI to localize, to identify the prostate. We fused those imaging studies together. And then what I did as a radiation oncologist was to identify specifically on the MRI and CT where the radiation had to go. And then along with my physicist and dosimetrist, we design how the radiation beams enter and exit through the body. And so for typical prostate treatment, anywhere from 100 to 150 small beams of radiation crossfire on the prostate. And where those beams come in and leave the body depends on how the target is situated with respect to all the critical structures, such as the bladder and the rectum.
Right. You're trying to be specific about where to direct it in order to avoid too much collateral damage.
Exactly.
Fascinating. Well, that's why. Are there any other tests that may be necessary for localizing the target?
Every situation is different. For some cancers, where we rely on something called a PET scan to identify tumors, we might use a PET scan to help. The doctors might use a PET scan to help identify where to target the radiation.
Needs to go then.
Correct.
Wow. So you could use any one of three locating devices or tests.
Yeah, generally it's a CT scan or an MRI scan or a PET scan or a combination of those studies.
Yeah, you mentioned that you took the two that I did, or that I went through, and combined them.
Correct.
How do you combine two different technologies like that?
Well, it's advancements in software technology and diagnostic imaging that allows us, and computer hardware systems that allow us to do that. So it's actually very commonplace to do nowadays.
Nowadays, I'm glad you said that. I'm certainly glad that I didn't have to go through this sort of thing 20 years ago or 10 years ago. When I heard about the CyberKnife program, I was immediately intrigued with the fact that the treatments could be all done within 5 treatment sessions. So anything in terms of success, is there a fair amount of success with this program?
Yes. There's the CyberKnife is not for everybody. It can't be used for all situations, but for the situations that we use it for, it is very highly successful. When we're trying to control a particular tumor or target in the body, if it makes sense to do so, then the CyberKnife is very good at that. Specifically for prostate cancer, there's multiple reports now on 5 to 7 years of follow-up that show the success rate in treating prostate cancer is between 93 and 99%.
That sounds very good, Dr. Tay.
In at least early to intermediate stage.
Well, I'm looking forward
cancer.
to that success ratio for myself.
So am I.
It's been such a pleasure to have you on the show today. I have the greatest respect for you and the program at St. Mary's and the Reno CyberKnife program in particular. I wish you well, Any final word?
Thanks for having me. It was a pleasure being on your show.
Thank you so much. Y'all listen up, folks. Call Reno Cyberknife if you wish at 775-348-9900.